Hello, I'm Dr. Melinda Whitfield from Health with Heart. Welcome to my kitchen, and today we are going to discuss the importance of one's weight in the context of COVID-19. First off, let's be reminded that 80% of people infected with COVID-19 will only develop mild or moderate symptoms. But according to the latest studies, being overweight and metabolically unhealthy increases your risk of mortality and hospitalization due to COVID-19 by more than 10%. Some articles suggested being the second greatest risk factor after age, and that should certainly get our attention. So we are going to discuss how managing what we eat, our exercise, and ultimately our weight can help to propel us into the 80% category of mild infection. Let's start with how we know we are overweight. So I feel very strongly that there is no such thing as a healthy weight, but rather a healthy person. But we do need some kind of guidance. And so I'd like you to use your waist circumference as a guide, and you'll understand why in a minute. So, using a tape measure, you need to measure your waist just below your belly button, and a healthy waist circumference in a man is less than 100 centimeters, and in a woman it's less than 88 centimeters. No cheating. You're not allowed to suck your tummy in now. So why is having an increased abdominal circumference, a beer bump or a muffin top a problem with regards to COVID-19? I'm going to touch on 3 points, but there are certainly more. So number 1, fat cells are metabolically active themselves. So this means that tire around your waist acts like an organ and releases hormones. The hormones make the body less efficient at clearing sugar from the bloodstream, and this excess sugar causes damage all over, eventually leading to diabetes and heart disease. These love handles and the hormone disruption have also been linked to an increased risk of dementia, cancer, and it also affects one's immune system, increasing the risk of all infections as well as autoimmune diseases. Number 2, we know that this belly fat implies excess fat inside one's abdomen as well and around our organs, affecting their functioning. And then lastly, these fat cells release inflammatory messengers called cytokines to the tissues around them. And this results in a constant low-grade inflammation, which when coupled with the inflammation from COVID-19 is like throwing petrol on a fire. And it results in the cytokine storm that I'm sure you've all heard referenced in the media. This might all sound very depressing, but don't despair. There are things that you can do starting today that will dramatically adjust your risk with immediate effect if you fall into this category. I'm a medical doctor and I'm not a dietitian, so please consult with one for more personalized dietary advice. But the following advice and the following tips I'm going to give you are applicable for general good health as well as weight loss. Number 1, you can't out-exercise a bad diet, so start there. Number 2, eat clean and wholesome foods in all the colors of the rainbow. What you eat should resemble the food in its most pure form and as nature intended it. This means eating an apple or a plum and a few nuts rather than the processed protein bar with additives and preservatives that definitely do not come from nature. Number 3, avoid sugar. This puts our body's metabolism under strain, and it is often the root cause of many chronic diseases of lifestyle. This also means avoiding low-fat products, as they add sugar to these products to make them more palatable after they remove the fats. Start reading labels, and you'll be astounded at what is added to our foods. Number 4, avoid carbonated drinks, even the low-calorie ones. They are full of additives that increase your overall inflammation. Fruit juice should also be avoided. Please don't fall into that trap. Rather eat an orange with all the fiber and goodness that nature intended than drink the sugary juice of 8 oranges. Eating the orange will also make you feel fuller, and you will be less likely to snack again shortly thereafter. Number 5, limit the amount of sauces you add to meals. Rather flavor with herbs and spices to avoid the hidden sugars. Did you know that there is 1 full teaspoon of sugar for every 3 teaspoons of tomato sauce you eat with your chicken or your chips? Eat good fats like avocado and oily fish, and avoid polyunsaturated fats like margarine, sunflower oil, and deep fried foods. Number 7, this one always makes me giggle. If you're not a cow and you don't want to look like one, don't graze. I know that in this lockdown period, I have certainly been inclined to snack and to visit my fridge a lot more often than I normally would. And when I reflect on this, it's not because I'm hungry. I'm still eating my normal meals during the day. It tends to be when I'm bored. So watch out for this. Number 8, avoid excessive alcohol. This is full of calories. And if you are going to drink, then reduce the amount and be clever about what you choose. There's 13 times more carbs in one beer than in a glass of champagne. Number 9, exercise for at least 30 minutes every day for 4 days of the week. You need to get your heart rate up, you need to be out of breath and sweating, and you shouldn't be able to sing a song at the same time. Then you know that you're exerting yourself enough. Number 10, get good quality sleep and go to bed before 10 p.m. Limit your screen time so that you can get at least 8 hours of good sleep every night. And the last one, number 11, manage your stress levels and incorporate breathing and meditation into your daily routine if you need it. Insight Timer and Headspace are excellent apps that are free to download on any device and can assist you with this. High levels of stress hormones affect your sugar metabolism and your hormonal health, and if left unchecked can also be a cause for weight gain. I'm going to leave you with a challenge. Not to focus on losing weight, but to focus on being healthy, and the weight loss will follow. So eat well, live well, and be well.